I am Stephanie. I'll be your nurse practitioner today. First, I'll wash my hands. What brought you in today?
Just for a checkup.
Okay. Tell me a little bit about your medical history.
I have ADHD.
Okay.
When I was younger, I went septic,
Okay.
and I had meningitis shortly before that. And that's all about my medical history.
Okay. When were you diagnosed with the ADHD?
In 2014.
Okay. And any surgeries?
I had bilateral carpal tunnel release.
Okay. Have you ever had your appendix removed?
Oh yeah, I did have that removed.
Okay. Gallbladder, anything else like
No.
that? Okay. And how's your overall general health?
I say it's good.
Okay, great. Have you ever been hospitalized for any of those things before?
I had meningitis, and when I went septic, I was hospitalized for those.
Okay.
Obviously, a surgery too, but
Okay.
that's it.
All right. Any traumas or injuries to head, knees, extremities, anything like that?
Not that I can think of.
All right. And what about your immunizations? Are you up to date on those?
Yep.
Okay.
Yep.
All your childhood vaccines?
Yep.
When was your last flu shot?
This year.
Great. What about your last tetanus shot?
I am not sure.
Do you take any medications daily?
Take my Adderall in the morning, and then multivitamin, vitamin C, and fish oil.
Great. Do you know the dosage of your Adderall?
25 milligram.
Great. And how often are you taking that?
Once a day.
Cool. Are you having any side effects from that? Mood swings, loss of appetite?
Nope.
Okay, very good. And do you follow anyone for your ADHD?
Neurologist.
How often do you see them?
Once every 3 months.
All right. What about allergies? Do you have any food allergies, drug allergies?
None.
What about contact allergies?
Nope.
All right, very good. And what do you do for your health maintenance? Do you get yearly checkups, blood work?
Yep. See my doctor once a year and get blood work.
Okay, and then do you get your eyes checked, ears?
I have not.
Okay, what about your dental?
Once a year.
All right, very good. And then do you know anything about your family history? Like your mom or your dad maybe? Do they have any heart problems, lung problems?
My mom is healthy, and my dad has high blood pressure.
Okay. And then do your grandparents on your mom's side have any medical histories?
They are not living, but not that I'm aware of.
Do you know how old they were when they were deceased and what they died from?
Late 80s, I think. Heart attack.
Okay. Both of them or just one of them?
I think both of them.
All right. And then what about your dad's side, his parents?
They're also deceased. One was heart failure, and I'm not sure of the other one.
Okay. And do you know their ages at all?
One was early 70s, one was late 80s.
Okay. And then do you have any family history of any stomach problems?
Nope.
Kidney problems?
Mm-mm.
Cancers?
Nope.
What about any psychiatric disorders?
Nope.
Has anyone ever had diabetes in your family?
Nope.
Thyroid disorders?
Nope.
All right. Any bone conditions, arthritis, anything like that run in your family?
Nope.
All right. And then any problems with neurological seizures, strokes, anything like that? No?
No.
All right. Any bleeding problems in your family?
Nope.
All right. Very good. What do you do for work? Or do you go to school or?
I am a nurse.
Okay. How often are you working?
3 days a week.
All right. And how's that going for you?
Pretty well.
Good. Any stress at all with that?
No.
Good.
Not at all.
What do you like to do for work or for fun?
I work out, hang out with my friends.
Okay.
That's about it.
All right. And how are your family relationships?
Very good.
Great. And do you think you have like a good support system at home with your friends and your family?
I do.
Okay. Do you have any religious beliefs?
My family and I are Christian.
All right. And do you attend church or anything like that?
I do on
Okay.
Sundays.
And what about, do you smoke or drink any recreational drugs?
No smoking, no recreational drugs, but I drink socially with my friends.
Okay. And then, do you feel like you have like any environmental risk factors for your health, maybe at work, anything like that, getting exposed to, viruses, bacteria?
At work, there's always a risk of being exposed to sick people and whatever they have.
All right. And then diet and exercise. Do you do anything to maintain your health? Do you eat healthy? Tell me a little bit about that.
I try to eat healthy, but it's not perfect, and I exercise at least 5 days a week.
Okay. What do you do for exercise?
I do weightlifting and a little bit of cardio.
Okay. Do you feel safe at home? No one's hurting you or anything like that?
I feel safe.
All right. And then, have you recently traveled anywhere?
Arizona, but nothing
Okay.
outside of the country.
All right. And then, tell me a little bit about your sexual history. Any history of STDs, anything like that?
No history of STD. I have one partner.
Very good. And then, kind of like general body systems. Have you had any fevers, chills, night sweats,
Have not.
fatigue, nothing like that? Okay. Have you had any itching, any lesions on your skin, rashes?
Not that I know of.
No. Okay. Have you ever had any head injuries?
No.
No, dizziness, seizures, nothing like that, correct?
No.
Just the ADHD?
That's it.
All right. And then, have you had any vision changes, double vision, vision loss, drainage from your eyes?
No.
No. Do you wear glasses or contact
I
lenses?
do not.
Okay. And then you said your last eye exam was do you remember when it was?
It was when I was little, but I don't remember exactly when.
All right. And then how have your ears been? Any vertigo, ears ringing, drainage?
Nothing
No.
like that.
Okay. Very good. Do you ever get nosebleeds?
No.
Allergies to, grass, any outside stuff like that?
No.
Okay. And then your mouth and throat, when was your last dental exam?
Earlier this year.
Okay. And you haven't noticed any like loose or missing teeth, no bleeding gums, sore throats?
No.
Has your voice been hoarse at all?
No.
All right. And then on your neck, have you noticed any painful glands on your neck, or has it been swollen, painful to move?
No.
All right. And then, have you noticed any like lumps or discharge from your nipples on your breasts or anything like
I
that?
have not.
All right. And any cough?
No.
Troubles breathing?
No.
Heart palpitations, chest pain?
No.
Do you have to sleep with multiple pillows under your head so
I
you
don't.
don't have a hard time breathing? No. Okay. Do you have any history of a heart murmur?
I do not.
Any calf pain?
No.
Okay. And do you know when your last EKG was?
It was around when I had meningitis.
Okay. Probably when you were in the hospital, you think?
Yeah.
Okay. And then, how's your exercise tolerance?
Very well.
Do you get any shortness of breath with it, or?
Nothing out of the normal.
Okay. And then no nausea, vomiting, heartburn, abdominal pain?
No.
All right. Are your bowel movements normal?
Yep.
Okay. Have you had any ulcers in your stomach?
No.
Okay. And then, are you going to the bathroom okay?
I am.
Any kidney stones, history of kidney stones, blood in your urine?
No.
All right. Have you noticed any scrotal masses, pain or discharge at your penis?
No.
Okay. Any hernias or prostate infections?
No.
Any difficulty with erection or ejaculation?
Mm-mm.
Very good. And then, do you do any testicular self-exams?
In the shower.
Okay, very good. And you haven't found any abnormal lumps or bumps?
Not that I've noticed.
All right. And then, how many sexual partners do you have?
One.
Okay. And no history of STDs at all?
No.
All right. Very good. And you said, we talked about no seizures. Do you have any numbness or tingling in your arms, legs?
No.
Any weakness that you've noticed?
No.
Okay. Are your joints stiff at all, painful, swollen?
No.
Have you noticed trouble moving your arms around, legs?
Mm-mm.
Okay. Any back, neck, or extremity pain?
Nope, I noticed.
Okay. And do you have any anemia?
No.
Have you ever received a blood transfusion?
No.
No. Okay. Do you bruise easily or bleed easily?
I do not.
All right. And then, have you noticed any excessive thirst or urination?
No.
Okay. Any heat or cold intolerance?
No.
Abnormal weight loss or weight gain?
Mm.
Okay. And then how have your hair, skin, and nails been? Normal?
Yeah.
Okay. And then no, you haven't been seeing things that aren't there or hearing things that aren't there?
No.
No mood swings?
No.
You don't want to hurt yourself or other people?
No.
All right. And then have you ever had treatment for any type of psychiatric disorder?
I have not.
All right, very good. So we will move on to the actual assessment where I assess you from head to toe. First, I'm just going to look at your general appearance. You're well kept, clean, your nails look good, you are alert and oriented, your speech is clear, you have good thought processes that make sense, memory is intact, long and short term. And then I'm just going to feel your skin here. Good. Skin is warm and dry and appropriate for ethnicity. And now I'm just going to feel your head here and your hair. No lesions or lumps or anything that you've noticed.
Mm-mm.
No abnormal growth patterns.
No.
Good. Hair follows a normal growth pattern. No lumps or lesions noted. Bone, head is normal cephalic. Go ahead and I'm just going to test one of your cranial nerves here. Give me a big smile. Good. Frown. Puff out your cheeks. Good. Cranial nerve 7 is intact. And now I'm going to test the sensation of your face. Let me know where you feel the sensation and if it's dull or sharp.
Okay.
Okay, so I'll have you close your eyes.
Right side.
Okay.
Upper.
Dull or sharp.
Dull. Left side cheek.
Dull or sharp.
Dull.
Good.
Right cheek.
Dull or sharp.
Sharp.
Good.
Left overhead.
Dull or sharp.
Sharp. Left chin. Dull.
Good.
Right chin. Dull.
Good. Cranial nerve 5 is intact. Next, I'm going to just feel your temporal arteries up here and then listen to them. Good. Pulses are 2+ in the temporal arteries. No abnormal pulsations are felt. Good. No bruise or thrills are heard upon auscultation of the temporal arteries. Great. Now we're going to move on to your eyes. So I'll have you stand up and we'll do the eye chart back here. First I'm going to have you cover one eye, read the lowest line possible, repeat it on your other eye, and then do both eyes together. Okay?
Okay.
Alright, go ahead and cover one of your eyes. Great.
ORGB.
One more time.
ORGB.
Okay. Try one line above that.
RK. CS. ZH. VD.
Perfect. And now try your other eye.
RK. CS. ZH. VD.
Good. Can you do one line below that?
SDKH.
Perfect. And now do both eyes together.
SDKH.
Okay, read it backwards.
HKDS.
Oh, alright, great. Go ahead and have a seat. Vision is 20/20, cranial nerve 2 is intact. And now I'm just going to take a look at your external eye structures here. Good. Good. External eye structures are intact. And now I'm going to get my light and we'll just test and see how your pupils react to the light.
Okay.
So I'm just going to turn the lights down. All right, go ahead and just look straight ahead. Good. Pupils are equal and reactive with appropriate accommodation. and now we will test your extraocular muscles here. Just follow the tip of my pen with just your eyes. Good. Cranial nerves 3, 4, and 6 are intact. Now we're going to test your peripheral vision. Let me know when you see your fingers in your peripheral vision out here.
Yep. Yep.
Okay. One more quick.
Yep.
Good. Good visual fields. And now for one more test, I'm just gonna have you close your eyes. Good. Real tight. Good. And raise your eyebrows. Good. Cranial nerve 7's intact. And now I'm gonna look into your eyes here. Alright, keep looking straight ahead here. Good. Good. Red reflex in the right eye. Cranial nerve 2 is intact. Move over here to your left eye. Good. Good. Red reflex in the left eye. Cranial nerve 2 is intact. Alright, now we're going to move on to your ear and mouth exam. First I'm just going to palpate your ears. No drainage coming from your ears or anything like that?
Mm-mm.
No? Okay. And then palpate your mastoid. Good. External ears are intact, no drainage or nodules, and mastoid is strong. Now I'm going to look in your ears. Good. Tympanic membranes are pearly gray. Ear canal is clear with a good light reflection. And now we're going to perform the whisper test. I'm going to have you plug your right ear. I'll stand behind you. I'll say 3 words. Not yet.
Oh.
I'll say 3 words. Repeat them back. We'll do the same thing on the other side.
All right.
Okay? All right. Plug that right ear for me.
Apples.
Good. Plug your other ear for me.
Baseball.
Good. And now we'll do the Weber and Rhine test. I'm going to perform the Weber test. Strike a tuning fork. I'll place it on your head. Let me know if you hear it better in one ear versus another, or in both ears.
Okay.
Okay?
Equal in both.
Good. Good job. Now we'll do the Rhine test. This time I will strike the tuning fork. I'll place it back on the bone behind your ear. Let me know when you can't hear it anymore, and then I'll place it right in front of your ear, okay? And then I'll repeat it.
Okay. Okay.
Good.
Okay. Okay.
Good. Air conduction is greater than bone conduction in bilateral ears. Alright, and now we'll move on to your nose here. No drainage or anything coming from your nose. Nose is midline. No drainage, no masses, no lesions. Take a look here. Go ahead and look up. Good. No septal deviation. Palpate your sinuses. Let me know if you have any pain. pressure. And now we'll move on to your mouth here. Look at your lips. No gum problems, missing teeth, loose teeth, anything like that. Try to open your mouth. Good. No missing teeth. Good. Go ahead and lift your tongue up to the roof of your mouth, side to side. Good. Stick your tongue out. Good. Open up. Say ah.
Ah.
Good. Alright, now I'm gonna look in the inside of your mouth here with my light. Open up. Say ah.
Ah.
Good. Good elevation of the uvula. Cranial nerve 9 is intact. Now, go ahead and puff your cheeks out. And then, oops, sorry. Stick your tongue in one of your cheeks and don't let me push it. Good. And do the other side. Good. Cranial nerve 11 is intact. I'll switch for some TMJ here. Okay, bite down. And then go ahead and open up. Good. One more time. Good. No popping or cracking. And the patient has good masseter strength. Okay, and now we'll move on to your neck. First, I'm going to feel your lymph nodes. Just let me know if you have any pain or tenderness with
Okay.
this. Okay. We're going to do pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, superficial cervical. Go ahead and turn your neck to one side for me. Good. Deep cervical, and go ahead. Supraclavicular. Any pain or tenderness?
No.
No lymph nodes were able to be felt or palpated, which is a normal finding due to no inflammation. So now we'll move on to your trachea. Trachea is midline, not displaced to one side or another. And we'll feel your carotid arteries here. Good. Carotid arteries are 2+, no abnormal pulsations. No bruise or thrills with auscultation. And now we'll move on to your neck here. Test your cranial nerve 11. Go ahead and shrug your shoulders against my hands. Good. And turn your head against my hand. Good. And this way. Good. Any pain, tenderness with that? Any problems?
No.
Alright, cranial nerve 11 is intact. Now we'll do some range of motion of your cervical spine. Go ahead and move your head up and down, ear to shoulder, other shoulder, and then go ahead and just turn it all the way around. Pain or tenderness with that?
No.
Good. Full range of motion of the cervical spine. And now we'll test your thyroid here. I'm just going to go behind you. Alright, I'm going to displace your thyroid to one side here. Go ahead and give me a big swallow. Good. Thyroid was displaced to the right. No nodules or goiter felt. Thyroid was within normal limits. No pain or tenderness when I did that at all?
No.
Alright, very good.
Fair enough.
Okay, now we're going to move on to your lung assessment. First, I'm just going to inspect the posterior chest. It's smooth, equal chest wall expansion, no masses. It's warm, skin's intact. Alright, I'm going to palpate here. Take a big deep breath. Good. One more. Good. Equal chest wall expansion with deep breathing. And now we're going to do tactile framatus. I'm going to place my hands. Every time I move my hands, just go ahead and say 99.
99. 99. 99. 99. 99.
Good. Tactile framatus is equal bilaterally. And now I'm going to percuss your lung fields here. Normal resonance is heard all over all lung fields. Alright, I'm gonna assess your kidneys, see if they have any pain or tenderness. Let me know if this hurts at all.
Nope. Nope.
Good. And now I'll listen to your lungs back here. Take a big deep breath. Good. Good. Lung fields on posterior chest are clear and equal bilaterally. Go ahead and turn around this way for me. And take your gown on. First I'll inspect and palpate the chest. Okay, now I'm going to assess the front of your chest. Just going to inspect and palpate. Skin color is good. No lesions are noticed. Skin feels warm. No mass is felt on palpation. And now we'll do the tactile fremitus. I'll place my hands against your chest. Say 99 every time I move them down.
99? 99? 99?
Good. Tactile fremitus is equal bilaterally. Now I will just percuss your lung fields. Good. Normal resonance heard all over the lung fields. Take a listen now. Deep breath. Good. Lift this arm up. Good. This arm. Good. Anterior lung fields are clear and equal as well as lateral. AP diameter is about 2 to 1. Alright, now we'll move on to your heart. There's no neck veins look good. No JVD sitting upright. Go ahead and lay flat. No JVD while laying flat either. On inspection of the precordium, no obvious pulsations are noted. Skin color is good, no lumps or lesions. So now I'm just going to palpate your chest here. I'm going to feel for the point of maximal impulse. Good. Point of maximal impulse is at the 5th intercostal space, left mid-clavicular line. And while you're laying there, I'm going to go ahead and auscultate your heart. I'm going to do it once with this part of my stethoscope, and then I'm going to flip it over and do it with the bell as well. Okay? Alright. Listen to the aortic. Pulmonic. Mitral, tricuspid. Good. And then same thing. Aortic, pulmonic, mitral, tricuspid. Good heart sounds S1 and S2 were heard in the flat position without any murmurs. Go ahead and sit upright. Actually, lay on your left side, please. Alright. And now I will listen again, same places, just laying on your left side. Aortic. Pulmonic. Mitral. mitral, tricuspid. Good, go ahead and sit up. Normal heart sounds S1 and S2 were heard without murmurs in the left lateral position. Now we'll do the same thing sitting up. Aortic, pulmonic, mitral, tricuspid. Aortic, pulmonic, mitral, tricuspid. Normal S1 and S2 heard in the sitting position without murmurs. Okay, now we're going to inspect your abdomen. Start back here with the flanks. Flanks are atraumatic, no ecchymosis, and as we stated previously, you had no CVA tenderness. Go ahead and lay flat for me. Good, abdomen is flat, symmetric, good skin color, no obvious bulges or masses are noted, and now we'll listen. Gotta move your arms for me, please. Good bowel sounds in all 4 quadrants. They were normal active. Just talk your bed a little bit. Now we're going to move on and listen to your aorta, spleen, liver, renal, iliac, and femoral arteries. Spleen, aorta, iliac, and renal arteries. Good. And femoral. And on inspection of the groin, it's atraumatic. No abnormal lesions or nodules. Good. 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 No thrills or bruits were heard in the femoral, iliac, renal, or femoral arteries, and there was no friction rubs heard over the spleen or the liver. All right, now we're going to percuss your abdomen. First, I'm going to start all over, and then we'll move and measure your liver border. Okay? Good. General tympany heard all over the abdomen, and now we'll move, measure your liver border. Good. Liver border, or liver measures about 7 centimeters. Now we're going to palpate your abdomen. Start with light just to get you used to my touch. Let me know if you experience any discomfort. Anything hurt?
Nope.
Good. No masses or bulging felt. Go ahead and bend your knees and we'll move on to deep palpation. Just gonna move your bed a little bit. Alright. Deep palpation. Anything hurting you here?
Nope.
Feel for your aorta. Good. Liver border. Spleen. Good. And then I'm gonna feel your femoral arteries here, so go ahead and straighten out your legs. Liver and splenic borders were not able to be felt, which is a normal finding unless they were enlarged. And you had good femoral pulses, they were 2+ bilaterally. Now we're going to move on to your hands, fingers, and range of motion. First, I'm just going to inspect your nails. Okay. Nails are well kept. Good. Good capillary refill. It's brisk, less than 3 seconds. Palms, no erythema. They're symmetric. Good. And now I'm going to look at your nail base angle. Go ahead and put your nails together. Just good. Good nail base angle. No clubbing seen. And now we'll take a look at your arms here, inspect your skin, musculature. Skin is warm and intact, no lesions, appropriate musculature for age. Now I'm going to feel your pulses. Brachial, radial, ulnar. Pulses are all 2+ bilaterally. Now we're going to test your range of motion. We'll start with your hands and then we'll do wrists, elbows, and shoulders. Okay? First, touch your fingers to your thumbs. Good. And then go back and forth. Good. And then bend your fingers down. Hyperextend them. Good. Full range of motion of the fingers. And now we'll do your wrists here. And then bend your wrists down. Hyperextend. Turn them in towards each other. No way. Good. Full range of motion of the wrists. Then we'll move on to elbows and shoulders. First, we'll start with your elbows. Go ahead and place both arms out in front of you. Palms towards your face. Good. Back down. Turn them over. Back up. Good full range of motion of your elbows. And then shoulders. We will put your shoulder out to your side for me. Up above your head. Back down. To your side. And then go ahead and do it in front of your body. Good. And then go across your body for me. Great. Full range of motion of the right shoulder. And same with the left over there. Go in front of you. Up. Down. Up. Good. And then across your body. Full range of motion of the left shoulder. To continue with your shoulders, go ahead and place both your hands behind your back. Good. And then place them back. Good. Full range of motion of the shoulders. Now we'll move to your lower extremities and your spine. Lower extremities have good color. No edema is noted. Good capillary refill, brisk, less than 3 seconds. Feel your pulses. DP, PT, and popliteal pulses are all 2+. And now we're gonna do some range of motion. First, we're gonna do your toes. Go ahead and just spread them out. Good. Bend them, curl them. There you go. Wiggle them. Good. Full range of motion of the toes. Now we'll do your ankles here. First, I'm gonna have you bring your legs together. And then at your ankles, turn them in towards each other. Good. Good. Away from each other. Good. And then just in towards each other like this. Yep. Good. And then out. Good. Full range of motion of the ankles. Now we'll do your knees and hips. You can go ahead and stand up for your knees. First thing for your knees, just go ahead and kick it back to your butt. And then out in front of you. Good. Other leg. Good. And then out in front of you. Great. And then go ahead and lay down. We'll check your hips. You have full range of motion of your knees. Okay, now we'll move on to the range of motion of your hips. Start with your left one. Just bring it straight up. Straight up. Good. And down. And then now knee to chest. Good. And now go ahead out to the side with it. Good. Across your body. Good. Do the same with the right hip. Straight up. Back down. Knee to chest. Good. Out to the side. And across your body. Good. Turn on your stomach for me. And then lift your hips up off the bed. Okay, good. Another one. Good. Alright, you can turn back around. Full range of motion of the hips. Now go ahead and stand up for me. And I'll have you bend over that way for me. Okay, good. Feel your spine. Good. No step off or deformity. Spine is midline, and no apparent scoliosis is noted. You can stand up. And we'll check the range of motion of your spine. You can face me. Go ahead and go backwards. Forward. Good. Side to side. And rotation. Good. Any pain with that?
Nope.
Good. Full range of motion of the spine. Go ahead and have a seat. Okay, now we'll move on and test your neurological function. First, I'm gonna have you, we're gonna test the motor function against resistance here. So I'm gonna push down your shoulder and shrug up against my resistance. Good. Do this shoulder. Good. Put your arm out to the side. Don't let me push down. Good. This one. Good. Muscle strength in the shoulders. It's 5 out of 5 bilaterally. And now we'll do your wrists here. And then like this. And don't let me pull against you. Good. Same thing on the other here. Good. 5 out of 5 bilaterally. We'll do some finger strength here. So I just need one finger. And push down on my hand. Good. And now we'll do your elbows. So bend up. And there you go. Pull against my hand. Good. Good motor function. 5 out of 5 strength in the elbows, wrists, fingers, and shoulders. We'll move on to your feet now. Go ahead and lift your toe up and push down against my fingers. Good. Good. Ankle strength, push down like you're driving a car. Good. Pull back toward you. Good. And then knees pull or push back against my hand. Good. And this one. Good. And for hip movement, hold your leg up and don't let me push down. Good. Good. Hips, knees, ankles, and toes have 5 out of 5 strength. Good motor function with resistance. And now I'm going to get my tuning fork. I will have you close your eyes. I will hit it and let me know where you feel it, whether it be your upper extremity, lower extremity, hand, toe, something like that. Okay?
Toe.
Good. vibratory sense is intact in bilateral upper and lower extremities. Now we'll test your sensation in your upper and lower extremities. We'll do the dull and soft, or dull and sharp again. Let me know what sensation you feel, if it's sharp or dull, and where you feel it. Okay, close your eyes.
Sharp on my right foot.
Good.
Dull on my left forearm. Dull on my right forearm. Sharp on my right forearm. Dull on my left foot. Sharp on my right neck. Dull on my left.
Good. Sensation is intact upper and lower extremities with sharp and dull sensations. Now we'll do some cerebellar function tests. The first one I want you to do is you're gonna put your finger to your nose and you're just gonna switch them back and forth. Good. Keep doing that. Good. Speed up a little bit. Good. Good smooth movements. Next one I'm gonna have you do is put your heel on your shin and just go up and down. Good. Do your other foot. Great. And then for some rapid alternating movements, hands on your knees, just come over, and then speed up a little bit as you go. Good. Any difficulty with that?
No.
Okay. And now I'm gonna assess your walking. So go ahead and stand up for me. Good. You can walk, come back here please, and then kind of walk diagonal. You're gonna walk heel to toe. Good. Good, and walk back. Good, you can have a seat. Good cerebellar function with good rapid, smooth, alternating movements. No abnormalities were noted. Alright, now we're going to test your reflexes. We're going to do a couple in your arm here and then a couple in your feet. Okay? Alright, let's start on this side. First, just relax your arm. We're going to do your biceps. Good. That's a 2+ reflex. And then go ahead and dangle your arm up, out to the side. And we'll do your triceps here. Good. And we'll do your brachioradialis. Good. Now I'll move to this side. Same thing. Biceps here. Good. And then triceps. Brachioradialis.
Good.
Okay, now we'll move on to your knee reflexes here. Perfect. And then we'll do your Achilles. Good. All deep tendon reflexes are 2+ bilaterally. Okay, now we're going to move on to test your proprioception. I'll have you close your eyes, and then I'll either put your finger or your hand up or down. Just let me know which position it's in, okay?
Toe down.
Good.
Toe up.
Good.
Toe down.
Good. Hand here.
Finger up. Finger down.
Good. Good proprioception sense in upper and bilateral extremities. Now I will have you lay flat. We'll do a monofilament test on the bottom of your feet. What I will do is I will poke the bottom of your foot. Just let me know when you feel the sensation, okay?
Okay.
Move your finger.
left foot.
Okay.
Feel that my right foot. My right toe. Left toe. Other left toe. Right foot. Left foot. Left foot.
Good. Good monofilament test. You can go ahead and stand up. And we'll do your Romberg test. Go back there. Good. Go ahead and stand in one place. Just close your eyes. Good. No dizziness or swaying. You have a negative Romberg test. Alright, now I'll just have you walk back and forth. Good. You can go back. Good, steady gait, no ataxia or cerebellar gait. Now, can you walk on your tiptoes? Walk. There you go. Good, now backward, or yeah, back. Good, and then walk on your heels. Great, and then go back on your heels. Good. That's all for this exam, so I thank you for your time.